what you should know about your nurse practitioners, the training, the profession, the career. We have two ladies here to take us through that. Dr. Carolyn Coleman. Dr. Coleman is president of the Nurse Practitioners Instructor at USM, and duly certified. Let me get all the credentials in here so I can get my coupon at the end of the day. Certified as family nurse practitioner, and also psychiatric nurse practitioner. She's worked many areas where nurse practitioners filled a critical role in crisis intervention for mental health, and also worked in the Delta, treating a lot of residents in rural Mississippi. And then there's Dr. Wanda Stroupe, who is vice president. She is a family NP in Ripley, Mississippi, where we've learned that the first Monday is still going on, by the way. And also has been an NP clinic owner for many years and provides a variety of services. Ladies, good morning to you, and thank you for coming. Dr. Wanda Stroupe and Dr. Carolyn Coleman. Let me go to Dr. Coleman first of all. Special activities this week. What do we need to know? How many nurse practitioners do we have in the state?
Okay. We have about approximately 7,100 nurse practitioners here in the state of Mississippi.
Whoa, did you say 7,100?
Yes, 7,100 nurse practitioners here in the state of Mississippi. Yes.
And they're all across the state? All
across the state.
All right, anybody, you guys jump in if you want to. This is just a little fireside chat here.
Okay.
But when we start talking about this, nurse practitioners is not new. How old is the profession?
How old?
Mississippi's had nurse practitioners for over 40 years. I'm not exactly sure how old the profession is as a whole, but I know we have had probably close to 45 years of nurse practitioners here in the state of Mississippi.
Why are they taking on more importance now in the last few years?
I think because of our rural area, number one, our health care here in Mississippi, we usually at the bottom of the chain, and our decreasing physician numbers here in the state of Mississippi.
And we're seeing that it has the scope of practice changed over the years?
Not the scope.
No, the scope of practice has remained the same. We've been trained to diagnose and to treat and to order test. That's been the same, and we've just had increased education. We've certainly advanced our programs with offering the doctoral programs that have come out over the last number of years, 15 years or so, and so we've got some great educational opportunities here in Mississippi for nurse practitioners, and particularly some really, really highly ranking schools for nurse practitioners.
Let me, because I'm a little confused, and some people might be asking this. When both of you are medical doctors?
No.
Okay, so you get the designation as doctor through the classification as nurse practitioner?
Well, for me, I have a doctorate of nursing practice, which I obtained at the University of Southern Mississippi. So I do have a doctorate, but I am a nurse practitioner.
And Dr. Stroupe?
Yes, mine is a doctorate of nursing practice as well from the University of Mississippi. So the degree is doctorate of nursing practice.
I got you. Do you think that confuses the patient?
Not really, because most of our patients know we're nurse practitioners. We certainly advocate our role in their care, so I don't think that's confusing. It's not being ever confusing to my patients and to the people I've dealt with. I don't think it has to most nurse practitioners.
And usually when I'm in the clinic, I introduce myself as, I don't always use doctor in the clinic because of the doctors feel like we're confusing them, so I just introduce myself. I'm your nurse practitioner always.
How do you get to where you guys are? Do you go through the higher education going from student to a nurse practitioner, or do you have to be a nurse for? Because I'm just asking. I have no idea.
Yes, you have to be a nurse first to come to nurse practitioner school. I teach at the University of Southern Mississippi, and I teach nurse practitioners. They have to have at least a year of nursing experience to come back to school.
They can go from practical nurse to nurse practitioner?
Not
or they have to be registered first?
They have to be a registered nurse.
I got you. So you have to kind of go almost like rank of military. You've got to get that higher and higher education.
Yes, sir.
Exactly.
So help me out here, Wanda, Dr. Stroupe. Tell me, what does it take as far as education to get a license as a practical nurse practitioner, I'm sorry.
Okay. As a nurse practitioner, of course, as Carolyn mentions, Dr. Coleman mentioned, you have to be a registered nurse first, and you can go many routes for that. You can go into the bachelor's program, or you can go to an associate degree program, and those differ by about a year and a half of education. But basically, you have 4 years of undergraduate, and then you go into your master's program, and that can go anywhere from 2 years to 1.5 years to 3 years, depending on what tracks you take. And then, of course, if you go to the terminal degree, your doctoral program is about the same. So you have to go through all those steps. And as Dr. Coleman mentioned, you have to have a year's experience as a registered nurse before you can enter into any of those programs.
So when we start talking about let's compare it to, say, a family physician. Is in the diagnostic area, is that where most of your training is? In other words, just to diagnose a problem?
Let me speak to that because I teach at University of Southern Miss. And some of the programs, we're changing. We have changed some of the program. For Southern Mississippi, University of Southern Mississippi, we only have doctorate program. We don't even offer the masters anymore because we're trying to get the education to a doctorate level nationwide with nurse practitioners. When they come into the program, we're teaching them on diagnosing, treatment. We're building on the knowledge that they already have and prescribing. So it's not just focusing on diagnosing, not just focusing on treatment. We do equally.
And when you say treatment, you're talking about giving shots, prescribing medicines, et cetera, et cetera.
Yes.
No surgery in there?
No surgery.
Lancing something or something?
Oh, yes, we do
small.
that. Yes, we
Okay.
do. We do procedures, but
just minor in-office stuff.
we suture, we open, we IND, we do, yes, minor in-office stuff.
We can do joint injections, just minor things that can be done in a clinic.
Will a student also is there some part of the course where you're taught as far as malpractice insurance? You'll have to have that and the cost of doing business?
We're working on that. We are incorporating that, and we have a transition to practice is what we do, and we do talk about the malpractice. We talk about businesses, and we touch on all of that.
One of the things, and I'm trying to get through this because it is a complicated thing as far as nurse practitioners are concerned, and I'm a boomer, so we've had to learn this when the doctor's not in, but we see a nurse practitioner, and it's one of the things in my age category that we just didn't have when we were very young, and it's just kind of feeling our way through this. A couple of other questions for him, and again, this is Nurse Practitioners Week. And we'll have more questions coming up. Back to learning more about nurse practitioners, Dr. Carolyn Coleman and Wanda Stroupe. And what do you want people to know about nurse practitioners? First of all, Dr. Wanda Stroupe, what should people know?
They should know that their nurse practitioner is competent to perform the care. They should know that we have an excellent education, that we are trained to diagnose and to treat and to order tests, and that we work closely in collaboration with a multitude of specialists across our treatment area. We've developed good networking relationships with the cardiologist. In my case, I'm up close to Le Bonheur and St. Jude, so I have a lot of discussion about my patients with those providers there. So we just have a great opportunity to provide care in the state of Mississippi to our patients that are local to us and be that frontline care and get them to the appropriate specialist when the time is right. And I think that nurse practitioners as a whole have just a tremendous education, a tremendous responsibility, but a great opportunity for us to provide care in the state of Mississippi.
To Carolyn Coleman, we carried this, we talked about this a lot at length in, I think, the last two legislative sessions, standalone clinics where you had to be in cahoots, a liaison with a doctor. Where does that stand right now?
Right now, we're still in legislation. We hadn't had any movement on it, and we're planning to go back to legislation.
So what's the rule? What's the rule as it stands now?
As of right now, a nurse practitioner, in order to work, we have to have a collaborative agreement with a physician to be able to work. So it's still in place as of right now.
And that physician has to be a certain mileage away?
Yes, it has to be within 75 miles, 75 miles.
And you were asking for what? To change the mileage or to just do away with that collaboration?
We're asking to do away with the contract. We're always going to collaborate.
Yeah.
We're just asking to do away with the contract.
Which means the contract is the point where you are under his employ or her employ?
No, you're not really under their employ. You just have to have a contract.
That contract costs you, does it not?
It does. It sure does.
So what I'm getting to is there an individual or set in law percentage that the doctor has for that consultation?
They can charge whatever they want to charge, and it's not just a consultation. It may not be a consultation. It may or may not. We don't. Sometimes you may collaborate with that doctor. You may collaborate with other physicians. We collaborate with a gamut of physicians, but you have to have a contract with at least one to be able to work.
You're just asking to do away with the contract. To do away with the contract.
We're not asking to do away with collaboration. We always want to collaborate.
To Wanda Stroupe, hasn't telemedicine changed this a lot in the last few years?
It's changed it some, but it hasn't changed the contract because the legislation hasn't changed. The contract is just one sheet of paper that says that physician has to agree to audit a certain number of your charts and to be available to you. The Board of Nursing does not require those chart audits. It's the Board of Medicine that requires it on the physician side. So telemedicine should have helped to some extent, but it really hasn't made a difference in the contract itself.
No. I think if I'm a legislator, I'm going to ask this question the next session. Would do away with that contract, is that enough of a financial incentive for nurse practitioners to open a practice financially and survive in areas where there are none now?
Yes, I would say yes.
Yes, most likely it would be in areas where there are none now because that would decrease their overhead considerably because that's something, for one thing, it's not just overhead. You have to have the physician available to you. So if you're opening a very rural area and there was not a physician willing to do so, or if suddenly he decided to retire or he moved, then you're left with no one and you can't practice. So you would risk your business if that collaborator suddenly closed his business because he has to be in a like practice. So that would be one thing. The biggest thing the legislature, I think, the trouble we have getting across is that we're not asking to change our scope of practice. We're already trained in the areas. We're already prepared to care for patients in the same way. It's just that one contract, which is one sheet of paper. So that's been our legislative holdup, is getting that removed.
Would you have a problem if you didn't have the financial mandate on there with finding a set number of doctors to collaborate with on, because it seems like you would be sending them some business one way or the other? Would that be a problem? Would you think you could be able to sign on some people? In other words, I can see where you would need a physician at the end of the day when you had questions or consultations that were not in your scope of practice.
Well, that is true, but you have a multitude of physicians available to you, just like a gynecologist runs into a cardiac problem with the patient. He goes to, physician or not, he goes to a cardiologist and asks him that question. We have that same thing. If we have hematology, we go to hematology. So it's not just that one
It's already built in. You already have that.
In, absolutely.
And it's not just...
You do have referral abilities to do that.
Absolutely.
Right, absolutely. And I also want to add to that, it's not just about the cost. It's the availability of physicians. There, like we talked about in the beginning, the decreasing number of physicians. So the number of physicians that we have to collaborate with is an issue. Just like in psychiatric mental health, the number of psychiatrists that we have in the state of Mississippi is very small. So the number of people that we have to collaborate with when we're trying to get mental health into these rural areas, the collaborators be able to find them, the number of physicians.
I'm wondering how many of you said 7,100 nurse practitioners in the state. I'm wondering how many of those are employed in a clinic where there's a physician now compared to standalone.
There's quite a number. Obviously, many more are employed compared to standalone, because when you have a standalone clinic, there are a lot of nurse practitioners that don't own the clinic but are responsible for the success of the clinic. Those are nurse practitioner managed clinics, meaning they may be owned by a physician or someone else, but they place them in clinics outside their typical area.
Yeah.
Then there are nurse practitioners like me who own their clinic, but like any other business, it's a risk. You're owning a business, you're running a practice.
Absolutely.
So you've got two jobs there. And so, I don't think that the fear that nurse practitioners will open multiple across the state is a concern for physicians as far as that goes, but I do think that it would encourage people to open in rural areas. But the biggest thing is the restriction to practice. If your physician doesn't see pediatrics that you have a collaborative agreement with, then even though you're trained and competent as a nurse practitioner to do that, you can't see those pediatric patients. You'd be sending those patients in a rural area to the emergency room if your physician didn't see, say, under 2 years of age. So that's one of the biggest stumbling blocks I see. It's not so much the financial, it's the access to care for patients.
I got you. Carolyn, if you held up a map and we could see this on TV, how many underserved areas would we have in the state, and where are they? Mostly in the Delta or scattered across the state?
I think they're scattered across the state, because even right here in central Mississippi, if you go into rural Madison County, those are rural areas there. Holmes County that are right here. So I think they're scattered across the state.
How is this narrative on hospitals having a problem financially and closing down, how does that play into this?
I think it's not a big thing with nurse practitioners, because nurse practitioners more work clinic areas. We can work hospital. I think we could be a help in those hospitals. But I don't think nurse practitioners are necessarily.
University of Mississippi Medical Center is working to grow nurse midwifery. Is it wifery or wifery?
I've heard it both ways.
I don't want to mispronounce two things in the morning.
Both ways.
Is that something nurse practitioners do, or is that under that banner, or is that just a standalone?
I think it's under advanced practice banner.
Is it?
Yes.
All right. We're almost out of time here, and it's been most educational, and I appreciate it so very much. But let me give you the final word, Dr. Wanda Stroupe.
Okay. Well, we just mostly want to be appreciative of the Mississippi Association of Nurse Practitioners and the program that we've got. We're just very blessed to have that in our state to support nurse practitioners, and we want to thank all the nurse practitioners across our state. 7,100 nurse practitioners across the state of Mississippi doing a fantastic job, we believe, taking care of patients and being frontline, taking care of those patients and assisting in any way we can with health care in Mississippi.
You got it, Dr. Carolyn Coleman. Your final thoughts?
I would just like to echo Dr. Stroupe in saying we just appreciate all our nurse practitioners from Mississippi Association of Nurse Practitioners and our board. We just like to say we appreciate each and every one of the nurse practitioners that are out there working hard, fighting the fight, taking care of our patients every day.
You got it. Dr. Carolyn Coleman is president of MANP, Mississippi's nurse practitioners, and Dr. Wanda Stroupe is the vice president. We thank both of you ladies for showing up this morning, and we now know a lot more than we did just a few minutes ago.
And thank you for having us.
Thank you.
We got more.